Welcome to this presentation on the cerebellum. First, what I want you to understand is the functions that relate to the cerebellum. We see the cerebellum in the image right in through here. One of the primary functions of the cerebellum is to modify motor output to ensure that it is smooth and moving in the right direction. It's also involved in the maintenance of our balance and posture. It helps to coordinate our voluntary movements. It's involved also in motor learning or motor skill learning. How to ride a bicycle, how to tie shoes are simple examples of motor learning. And it's also involved in cognitive functions. Next, I want you to understand the fact that the cerebellum is divided into lobes, and we have a colored view of 3 lobes of the cerebellum. This is a sagittal view. The first lobe to identify is the anterior lobe, and it's identified by the number 1 in the light green area. The posterior lobe is the larger of the 3 lobes in this view, and you can see it in the pinkish red area. And then the third is much smaller in contrast to the larger anterior and posterior lobes, and that's identified here in the orange area, and this is referred to as the flocculonodular lobe. Here's another view. This is an anterior view of the lobes. Here is the anterior lobe, in through here, and on the opposite side. The flocculonodular lobes are these extensions that we see here where it's labeled, and this is the opposite flocculonodular lobe over here. The large posterior lobes are shown here and over here. And then a division between the lobes in the midline is this structure referred to as the vermis. And that extends here as well. The cerebellum can also be divided into hemispheres. And we're going to use that same anterior view to identify the various hemispheres of the cerebellum. There are 3. The first is the vermis, which is located right in through here. This is involved in controlling the axial and proximal limb musculature. If there's a lesion in this area, it can result in ataxia of the trunk, those axial musculature, and patients will sway with their eyes open due to the proximal limb musculature inhibition. A primary cause here of damage to the vermis is in chronic alcoholics. They develop a nutritional deficiency of thiamine, and as a result, there can be generation of the superior aspect of the vermis, and as a result of that degeneration, you're losing your motor output because you lose your Purkinje cell population or density here. The intermediate hemisphere is just lateral to the vermal hemisphere. This is also termed the paravermis. It's going to control distal musculature, and if there is a lesion of this area, then you'll have an inhibition of your distal musculature control. The largest hemisphere is the lateral hemisphere, and we see it running between these 2 green lines. This is involved in motor planning. Symptoms of lesions usually include a lesion to the intermediate hemisphere as well. This could be a stroke, loss of blood supply, or it could be a tumor impacting these areas or hemispheres of the cerebellum. But the symptoms of a lesion would include ataxia of the extremities. These individuals would exhibit an intention tremor. So as they move their upper limb, for example, there can be a tremor associated with that intentional movement. Nystagmus is another symptom. Dysmetria, an inability to judge the distance between your hand and the object that you want to pick up, for example. Decreased muscle tone, hypotonia, and lastly, deep tendon reflexes are weak.